being a nursing student can be challenging sometimes. It can really be challenging. So this is a story time, quick story time. So you know how you go into practice and you see a lot of things go wrong, and because you don't want to lose your pin even before you get it, you have to speak up. In fact, just you better not be there when it's happening, or speak up. Learn the courage to talk or counter things that do not align. You know that for sure this is not fair in healthcare. But this is even a story for another day. But let's go straight to this one I want to talk about right now. So, you know, I'm a nursing student in the UK. I'm an international student and I work in care. Currently, I work as a healthcare assistant. I go to care homes or support jobs, like things like that. I actually work in care. So this day, my agency sent me to this very particular home that I've not been before. And unfortunately for this staff, or unfortunately for some of the staffs, they were having a summer party because the weather is really hot now. Like in the UK, we are boiling, we are roasting. So, and this care home is a two-story building, and I was working in the second floor. And unfortunately for the staff, some of the staff there, you're having to bring down people, even the people that are bed bound. Not bed bound per se, but they usually do not come out even on a normal day. They will leave them upstairs, like they will leave them in their bed. They just have to shower them and put them back in bed, or maybe wash and leave them in their rooms, right? On this day, everybody had to just dress up and come down, which some people did not buy. Like they were not happy about it because people wanted to be lazy, you know, with their job. And that is how we went into this very particular lady's room. And me and this carer that we were working with, I was working with, she went to the woman, was like, hi love, would you are you coming for the party? And the woman was like, is it worth it? And she said, you can stay in your room if you're tired. You can, you know, have a sleep, go back to sleep. You're tired, right? You don't want to come down. And the woman, you could see that she's very free and she just didn't want to be a bother. She was like, yeah, I'll just go back to sleep. I'm okay. Thank you. I'll stay back in bed. And like, I look at the kid, I'm like, you know, you're putting words in this woman's mouth right now. You know that this is like, because I know this is not fair. Most of the time, she is in her room. And this is just a one-off opportunity they have. They don't have it all the time, and you want to rub it off her. Like, we're not having that. We're bringing her downstairs. She wants to come down. And that was how I made an enemy for the rest of the day. So this carer wasn't happy about that at all. She was not happy about it. She felt challenged. Like, how can an agency come in here and tell me what to do? That was how she felt. And I made an enemy for the rest of the day, that she found a way to actually try to make my shift, the remaining time I had there, miserable by finding chores or jobs that were not supposed to be done, like trying to give me things to do, which I didn't mind. It was okay. Let's get stuck in. This is things we see and we need to challenge as nursing students or as people that care about what they're doing. Like, you have passion for caring. You have to be able to have the courage to stand up and speak for the people you care about. Your responsibility, that shouldn't have been my direct responsibility because I'm an agency. I don't work there permanently. But guess what? It's not in me. I just had to counter that day. We needed, and I survived. I'm still alive.